Nutrition is the most important thing that physicians should know because it determines so many different aspects of disease.
Doctors are not taught. They get their knowledge how everyone else gets their knowledge, basically, through the media.
There's a lot of myth about it because people are afraid if I don't eat meat, I will run into a protein deficiency. That's a myth that doesn't exist, but it's planted in our brains.
The meat, dairy and egg industry are having quite significant influence on the information going out to doctors.
Nutrition is important for medical doctors because many of our chronic diseases are related to nutrition.
Doctors don't know about this, and we didn't know about this until 6 years ago because nutrition is hardly taught in medical schools around the world. So you spend 4, 5, 6 years in medical school to learn all the other things. It's a big topic. And nutrition is only taught for a few hours.
In order to become a cardiologist, for example, one has to go to college, medical school, an internal medicine residency, and then do a cardiology fellowship. Throughout every aspect of that training, we get very little, if any, nutrition training.
Nutrition, or bad nutrition, is behind so many of the chronic diseases that we treat.
Nutrition is, in my view, essential for medical doctors to include in their practice, in their treatment of patients, because with nutrition we are able to influence chronic diseases in a very positive way.
Nutrition is the most important thing that physicians should know because it determines so many different aspects of disease.
When you look at the Western world, we live longer than ever, but also the chronic diseases are still increasing. Type 2 diabetes is thriving in the world. Cancer is increasing.
Many of these chronic diseases can be stopped or even reversed. Looking at heart disease, diabetes type 2, or even certain cancers.
I think it's essential to make a change and to add plant-based nutrition to the treatment of patients, because we can not only stabilize diseases, we can even reverse it.
That is something that we won't see with the modern medicine we have today, with the pills and the procedures.
Nutrition is actually seen as a separate specialty. There's nursing, there's physical therapy, there are a variety of things that make up our team-based care. And nutrition has always been off in the aspect of someone else. And we do have nutritionists, and our nutritionists in the United States particularly are pretty good at diabetes control. Not quite as good, based on the evidence, at lowering people's weights. But those are the real two things that they have tried very hard to do. There hasn't been a lot of traction, unfortunately, in the area of regression of disease or treatment of inflammatory conditions. Those they believe belong to the physicians, and it really should be quite the opposite. We should know more about nutrition. They should know more about prevention of a variety of disease, particularly through plant-based dieting, because the data is actually out there. A lot of the data that I quote is actually in the American Journal of Clinical Nutrition, and articles that they should be actually very familiar with, and yet we just have a handful of plant-based physicians and a smaller handful of plant-based dietitians.
Doctors are not taught about it because there is a lot to learn in medical school. You have to learn anatomy, they have to learn... If you discuss this topic with people in the university, they say, well, we cannot accommodate because it's not regarded to be important. It's not yet a priority. Why? Because doctors and the universities have not understood how powerful plant-based nutrition can be.
Doctors in general don't know about the power of nutrition in healthcare.
Part of it's that we don't get a lot of nutrition education in medical school.
But now we know, also through the WHO since last year, that red meat is a possible cause of cancer, for instance. So it's not our best friend, but doctors are not taught. They get their knowledge how everyone else gets their knowledge, basically, through the media. And the media are not educated either.
And I think more recently what's happened is there's an emphasis on evidence-based medicine, where the highest level of evidence is considered a double-blind randomised controlled trial where Group A gets this tablet and Group B gets a placebo. And of course that favours high levels of evidence for drugs and that actually only have small benefits, but well-proven small benefits. I think also in recent years I've noticed in my medical magazines here in Australia that the meat, dairy and egg industry are having quite significant influence on the information going out to doctors.
The difference in treating a patient with medication compared to nutrition is in chronic diseases. What the doctor will see is that the patient will get better. And for instance, if there is hypertension, the doctor will have to lower medication and eventually stop. And diabetes type 2, even when people have been for years on diabetes medication, if they are really adherent to a whole food plant-based diet, the doctor can eventually usually bring down medication and in many cases stop. So that makes that's for the patient, of course, an enormous. It's also that they don't have the side effects of medication, and also that their whole chronic disease will not progress any further. For instance, with diabetes, there are so many complications. Heart disease is the biggest one, but also blindness or kidney disease. Imagine that you stay away from all of that.
There are a few conditions, and particularly in cardiology, that you're born with it. Congenital heart disease, there's something there's nothing you can do about it. There are cholesterol conditions such as familial hyperlipidemia, and if you have those genes, you're going to have a difficult time with cholesterol management. But for the most part, I would say a good 95% at least of what we do are degenerative conditions that actually occur because of what we eat.
So it's fantastic for the patient, but imagine what it would be for the doctor as well.
Most of us became doctors because we want to heal. We want to treat diseases so patients can live a perfectly happy life. And with a lot of the chronic diseases, that's not the case, because we are proud of the fact that we live longer, but we live many more years probably in misery due to a lot of chronic diseases. So doctors can experience firsthand that patients get well and they feel great about it. Having
a whole foods plant-based diet in your sort of medical toolkit or armamentarium of medical treatments, I guess would give you a treatment option that was actually going to get people better, because it was going to be taking away some of the causes. And so rather than just giving someone their blood pressure or diabetes tablet and gradually watching them get worse over the years, albeit more slowly if you treat them well and manage their disease well, you'd actually see some of them get better. And that would also be good for the doctor as well, because we'd actually be able to feel good that our patients were getting better.
As a doctor, you want to heal patients. And with chronic diseases, that's basically not possible. They will tell the patient, these are the medications you have and you will have to use them for the rest of your life. Wow, that's quite a sentence, isn't it? And now they can heal the patient and bring down the medication and get them off medication. So satisfying for a doctor as well, that you actually can see the patient get better.
Here at the American College of Cardiology, we are working on developing a larger database of review articles. Some of them are actually in review right now and hopefully will be published soon. They're really aimed at cardiologists, but this is an area where more and more literature is happening every day. You have some real gurus around the country in the United States, such as Michael Greger. He has a wonderful website. He's a family practice physician, I believe, who spends pretty much all of his time writing and reading about nutrition. You have Caldwell Esselstyn with his website, Dean Ornish with his website, Joel Furman. You have a lot of people who are dedicating themselves to getting the word out. And so there really is not a paucity of information right now, and just a Google search such as regression of heart disease, for example, will bring up a lot of these things.
The question is now, how can doctors educate themselves in nutrition, because it's not really taught in continuous medical education either. Although I have to say, especially in the United States, there are now conferences specially geared on nutrition, plant-based nutrition and health. So there is the International Plant-Based Nutrition in Healthcare Conference. The last few years it was always in Los Angeles and Anaheim. But there are a lot of other plant-based nutrition conferences. PCRM, which is the Physicians Committee for Responsible Medicine in Washington, D.C., also every year has a nutrition conference. And so that's a good way, of course, to start and to get a little bit an idea.
How can you educate yourself more about plant-based nutrition as a doctor? There are 2 books I could recommend. This is easy to read. That is the so-called China study, which was a study done in rural China. The conclusion of this book is the more plant-based food people would eat in rural China, the less prone they were to chronic diseases. Very easy to read and very compelling.
Another good book is one that came out last year. It's called How Not to Die, which means not you will die in the end, but how not to die of chronic diseases and how not to die prematurely. And this book by Dr. Michael Greger writes about the 15 leading causes of death and the research behind it, what nutrition can do for it. And it has about over 2,500 references. So it's all referenced. So all the research people can find and read it themselves.
And there is actually a certificate level course that you can do online to get a certificate in plant-based nutrition with eCornell.
A whole food plant-based diet is a diet based on 4 groups: fruits, vegetables, whole grains and legumes.
You know that you get all the nutrients you need if you eat from all 4 quadrants.
The best way of consuming these foods is as whole as possible in their natural state. So don't process them too much. It's better to eat an apple than to drink the apple juice. So we get also all the fiber and all the nutrients that come with them.
The only thing you would need to supplement is vitamin B12. But if you eat balanced from this so-called power plate, that's the core, that's the secret of whole food plant-based nutrition.
There's no need for meat for iron or dairy for calcium. And as for protein, yes, my giant morning bowl of porridge actually meets the Australian Institute of Sport athletes post-training protein requirement of 20 grams plus.
What is also a pleasant side effect of this diet, the food is rich in nutrients and very low in calories. Most of the typical Western food is the other way around. You have a lot of calories and hardly any nutrition.
I always tell folks that they need to supplement 2 things when they're doing a completely plant-based diet. Number 1 is B12. And why is that? Because if you're eating animals that eat dirty vegetables. If you eat dirty vegetables, you're going to get B12, it comes from the soil. If you're a human and you're a vegetarian, you're probably going to wash your vegetables, and so you're not getting that B12. So just take a B12 supplement. Don't eat the animals who ate them. It doesn't make sense. The other thing that you have to supplement is the retirement income, because you're going to live longer. So those are the 2 things I warn people. The other nutrients are actually all there, pretty much. I mean, people will argue about some very arguable things like, oh, you've got to have omega-3 fatty acids. Well, first of all, there are vegetable sources of omega-3s. Point A and point B is that in cardiology, all of our omega-3 fatty acid trials, it'll prevent heart attack, it'll prevent stroke, it'll reduce rhythm disturbances. They all blew up, they were negative. And so that's happened with pretty much every supplement in cardiology. Vitamin C, vitamin A, notable for the fact that it increased, if the patients were in the smoking group, it increased the lung cancer rate. So we really don't recommend vitamin A in smoking. Vitamin E was another one in the HOPE trial that did absolutely nothing. Folic acid. So why am I listing all these things? Because they're embarrassingly things that we used to actually prescribe, and we had to go back and take the prescriptions back. And when the large randomized trial said that they actually don't do any good, and some of them showed a tendency toward harm. So in terms of micronutrients, if a person is eating a whole food plant-based diet, with or without the veggie burgers and the processed soy and the processed stuff that I don't see the data, I see a lot of opinions, a lot more heat than light, okay, if you know what I mean. If you're eating that sort of diet, you're pretty much getting everything, and just watch the B12.
In general, people are a little bit scared if you talk about whole food plant-based diet and eliminating all the animal products, because they are afraid that they might miss out on certain nutrients. And I understand, because generations have been brought up that we need meat and we need dairy. We need meat, the protein and the iron from meat, and we need from dairy the calcium. But think about it. How did it get in the animals in the first place? They got it from vegetables. The animals we eat are vegetarians, are herbivores. So we can eat it straight from the source instead of eating it through the middleman, the middle animal. And the animal, eating it via the animal gives us a lot of toxic products in our body. Even the iron from meat is highly oxidative in our body, so gives a high oxidative stress. It always has saturated fats, which are not healthy, trans fats, certain hormones, where even if the animal is not being given extra hormones, it has growth hormones that can promote cancer in our body. So we should cut out the animal in the middle and go straight to the plants ourselves.
There's a lot of myth about it, because people are afraid, if I don't eat meat, I will run into a protein deficiency. That's a myth. That doesn't exist, but it's planted in our brains. The same, oh, what about my iron? Well, whole food plant-based nutrition offers you a lot of the natural iron. So don't be afraid, it's okay.
The real question about whole food plant-based diet is, what doesn't it cure? I've actually been many times, if I just give you the last few months, sitting in a clinic, getting a lot of referrals these days, specifically for nutrition, interestingly enough. So we call it our cardio nutrition department within cardiology now. And it's interesting that I'm sitting there, because of the electronic medical record, I have to have the computer open anyway. And as I like to share with people, whatever literature, whether it's Esselstyn's image of the artery that opens up, I actually show those to patients because I've got, a search engine right there. Well, I've had the experience of having patients sit there and ask, well, I also have multiple sclerosis, ulcerative colitis, diabetic neuropathy. These are ones where, and I actually would type the word diabetic neuropathy vegan diet, and an article comes up. Invariably, these conditions actually have some data, and that particular one, it was just dramatic improvement that occurred. It's actually done, that study was done by Neil Barnard in the United States, another sort of plant-based guru. Then you've, for the ulcerative colitis one, a real randomized trial was done and showed that you have 0% recurrences in the first year and 10% in the second year. There's no medication that could come close to matching that. So I'm really wondering at this point, everyone knows, if they're in the tennis world, about the inflammatory condition of lupus and Sjogren's syndrome, because Venus Williams had Sjogren's syndrome and wasn't able to play, and then they put her on the steroids and her joints would feel better, but then she couldn't really practice as well, and someone asked her to try a vegan diet, and she's back playing, and she's 36 or 37. She played really well yesterday.
One of the problems with the Western diet the food contributes to what we call chronic inflammation. That means chronic irritation in your body, and that is probably one of the root causes of the chronic illnesses we have discussed before. You reverse that process because the nutrients in plants are rich in cancer-fighting properties. They have anti-aging properties, and the list goes on and on.
Bottom line is, I think we have some literature on a variety, particularly inflammatory conditions, where it seems to make sense, because we do know that C-reactive protein, an inflammatory marker in the body, does go down, cholesterol goes down. It may be that everything that has to do with inflammation improves dramatically with plant-based nutrition, and it ought to be a cornerstone of therapy of every one of those conditions.
Plant-based nutrition is not only good for heart disease, for cardiovascular disease, but also for type 2 diabetes, for obesity, but many other conditions. We know, for instance, autoimmune diseases, for instance, rheumatoid arthritis, or psoriasis, or Crohn's disease, all chronic debilitating diseases, and with a strict whole food plant-based diet, these diseases can be reversed. Another example, erectile dysfunction will respond to plant-based nutrition. Some forms of cancer, like low-grade prostate cancer, responds well to plant-based nutrition. Even we have now Alzheimer's disease. We know that people on a typical Western diet, including meat and the heme iron, are more at risk to develop Alzheimer's disease. Blindness, cataract, old age blindness, the same experience, lower risk when you're on a plant-based diet, higher risk when you're on Western diet. So it's a little bit boring, but it's a very consistent pattern throughout many diseases.
The beauty with a whole food plant-based diet is that it's not only healthy for people that have heart disease or diabetes, but for most of our chronic diseases. And there are many of those. So, except for heart disease and diabetes, many cancer can be prevented, or even when people get cancer, they can help their body heal with a whole food plant-based diet. But also autoimmune diseases, for instance, rheumatoid arthritis, Crohn's disease, colitis. All these illnesses are basically food-borne. They start in our gut. And when we have a very healthy gut, we will get rid of these diseases. And that is wonderful. That's amazing. Animal-based foods can disrupt the healthy bacteria in our gut. And the plant-based foods will restore it. And that is one way of healing our bodies.
A whole foods plant-based diet has been said by experts, much wiser than myself, to have a wide breadth of effect. That is the same diet that can help people lose weight, that can reverse heart disease, can also improve diabetes, can also be used to treat autoimmune disease. It can also be used to slow the growth or prevent cancer in some instances.
We talk about whole food plant-based diet, and other people might say, yeah, so that's vegan. And in a sense, that is true. It's vegan. We are not eating any animal products.
You can be a vegan and not eat any animal products because you could still be a junk vegan. You could still eat a lot of processed food or food which is very high in fat or trans fat or very sugary.
And that is a big difference, because people that eat whole food plant-based, they come from the health side of things. And are in the first place focused on health. So vegans also bring it further. They will avoid any animal products in everything they use. So cosmetics, their shoes, you name it, everything they use, they don't want any animal to be hurt. For the whole food plant-based people, that might be the case, but is not necessarily the case. So some people that purely do it for health might still have, like leather shoes, for instance.
The difference between a whole foods plant-based diet and a vegan diet is that the emphasis in the whole foods plant-based diet is, we like to look at it as of adding in. The emphasis is on eating lots of whole grains, legumes, starchy, non-starchy vegetables and fruits. Whereas a vegan diet can include, and often does include, highly processed food like vegetable oils and refined grains, and processed food like vegan meats and vegan cheese. And although it could be said that a whole foods plant-based diet, I guess, is a form of a vegan diet, you can have a vegan diet that's actually not very healthy and not based on many whole plant foods at all.
In the United States, this is becoming a huge business, meat replacement, animal product replacement. And so every few months, as I'm showing my patients something that they could use instead of whatever their favorite toxic animal product is, and I've actually had incredible success going to a search engine, type in vegan blank whatever, okay? And I've struck out 3 times. One woman wanted bison, a guy wanted armadillo, and a person wanted possum. There are no vegan possum products, but if you go with mainstream American diet, you can get almost everything completely replaced. Chicken is probably the biggest product, just the number of things and the number of plants that can be turned into chicken. And it's everything from mushroom protein to whole grain to soy to so I'm not actually sure I know what Gardein protein is. I think it's chickpeas perhaps, but they, multiple brands, and you can get, it sounds a little bit like that Forrest Gump movie, when he was talking about the shrimp. You really can get chicken nuggets, chicken breasts, chicken patties, chicken legs, you can get chicken anything in most grocery stores. And so the first thing I do, if I can convince them to do a whole food plant-based diet, great. If they're reluctant, I immediately go to the transition diet. Tell me what you like and I'm going to find it for you.
Although most people who've changed to a whole foods plant-based diet will tell you just change overnight, changed instantly, when you ask them how they did it, most of them actually took weeks or even months to do it. Because it can take some time, and some people might say just start having some meals, maybe make you breakfast whole foods plant-based each day. And I guess it depends on the urgency. If you've just had a heart attack, you probably want to change virtually overnight. If you're an otherwise healthy athlete, you might want to spend several weeks sort of leaning into it and slowly changing over.
Ben & Jerry's, one of the biggest ice cream manufacturers in the United States, they make vegan ice cream. Now, if you're overweight and you're diabetic, I don't think that that's a good idea to eat ice cream of any kind. But I know it's not going to increase your plaque burden directly, it's just going to be a little more indirect. And so I think if people are really struggling, this whole idea of a transition diet where you convert everything, and you could do this. Burger King, not McDonald's, but Burger King in the United States has a veggie burger. White Castle, which probably doesn't exist outside of the United States, I wouldn't think, but it's a burger chain. They started making veggie burgers about 2 years ago. And the products actually sell. And so I'm not convinced that it's the best thing for everyone because it still has a lot of the American fat and salt content, which people should be very careful of, particularly if they're overweight, diabetic, and hypertensive. So anyway, but this is an opportunity to get people to change, get out of the idea that they're going to go to the meat counter and buy meat. They can get different kinds of cheese, all made out of plants. And if folks are fans of milk, there's an interesting thing. A few years ago, there was soy milk and almond milk, and now there's about 12 different kinds of milk. And I don't know if you can get them here in Australia, but you certainly can in the United States. I mean, things I'd never heard of. Rice milk, okay. Hemp, okay. And so, there must be a massive amount of money in this business because people are really going into it. And but it does give us an opportunity to get away from the animal products, so I welcome it.
I think the greatest challenge with changing to a whole foods plant-based diet is eating out and having other people prepare your food. I've had patients who are You know, sort of pretty ordinary middle-aged guys who live at home and are not very complex about their cooking or anything, and they say to me, look, at home this is really simple. It's so simple to cook whole foods, plant-based. But then as soon as you start going out to restaurants or cafes where other people start preparing the food, suddenly there's oil poured into everything. The grains are often refined. There are all these processed plant foods in there rather than whole foods. And I find that when I try and eat out, one of the challenges is not just getting the processed foods out of the meals, but it's actually getting enough calories of things like brown rice and wholemeal pasta and potatoes and beans.
I've had some people say that if they go to their particular grocery store and they look at the hot dogs and then the vegan hot dogs, that the vegan hot dogs are more expensive. I think that's not uniformly true, but expense can be an issue. And my response, of course, is, well, don't eat the vegan hot dogs, let's do whole food plant-based. It's very inexpensive. It's just, so finances can be a major issue. The other major problem is just the fact there's inertia. People are used to doing what they've been doing, and it's hard to get them to change. And it's hard to see, even if you show them a picture of Bill Clinton after his second cardiac procedure, and then changing to plant-based diet, and he's great now. Well, that's someone else. And it's interesting that we all have this idea that we're somehow immortal and we can smoke cigarettes, but we won't get lung cancer and that sort of thing. It's just, and then there's a handful of us that are exactly the opposite. They're pretty sure that whatever I do is going to get me, and therefore I'm going to do the best I can. If it's much easier to deal with those kind of people than the people who really are resistant to understanding that they have a direct impact on their outcome with their choices.
When people hear about whole food plant-based diet and they think, wow, that sounds really interesting, that, I would like to do that. How should they start? And that's not always easy, because usually people think, oh, I have to leave out now the dairy, I have to leave out all meats. So now there is a big gap on my empty place on my plate. What do I do now? And yeah, it's not easy. I think the Physicians Committee for Responsible Medicine, PCRM.org, is a really good website to start off with. Very comprehensive information on all sorts of issues related to this way of eating and your health. Also for pregnant women, for lactating women, the babies, so that's all been addressed. They also have a 21-day Kickstart program. It's all for free, you only have to register. It starts every first of the month, and I think that's a really good and also fun way, because they have good videos, they have certain celebrities that talk and are also involved, so I think that would be a good approach. Furthermore, in Australia, we have a really good website, very comprehensive information and quality information there. It's called wholefoodplantbasedaustralia.com.au. And there is also, for people that are on Facebook, a very supportive Facebook group called Whole Food Plant-Based Aussies. And that's where you find a lot of information, but also a lot of support.
To overcome the challenges in following in trying to transition to a whole foods plant-based diet, you could do a live-in program and go and do a 10-day John McDougall program or something like that. But I guess it might mean mostly cooking your own food within your own family for a period of time, and starting to regard going out as more a social event and being less dependent on the food you might get when you go out.
How can a whole food plant-based diet lifestyle reverse heart disease? It's too good to be true, but it's true. We have seen in very reliable research that patients suffering from coronary artery narrowing, so with the well-known chest pain, the angina, one group of these patients were given a whole food plant-based diet. The other group of patients followed the advice of their cardiologist, and we could see after 2 years and after 5 years that the narrowing of the coronary arteries actually improved. we could also demonstrate in those patients that they had significantly less chest pain and had significantly less cardiac events. And this is amazing because with all the cholesterol lowering drugs, with all the procedures, with the angioplasties, we can sometimes stabilize disease, but we cannot reverse it. And I don't know of any other diet so far but whole food plant-based nutrition where this was demonstrated in very solid research.
A whole food plant-based diet can reverse heart disease, and we have seen that with angiograms and certain scans that can see how the heart muscle is being oxygenated, gets its blood before the start of going on a plant-based diet and afterwards. But now, how does that work? Why does that happen? I think we have to realize that all these chronic diseases, including heart disease, is a chronic inflammation disease. And because of the high fats, for instance, but it's not only saturated fat and cholesterol, there are other factors as well that comes with animal products. The heme iron, for instance, so the blood iron, and also products are being produced by through our gut bacteria, and then the liver. It's called TMAO. It's highly atherogenic, so that means that it damages the artery walls. When we take away these inflammatory components from our diet, then the body gets the opportunity to heal and starts just cleaning out the garbage, basically. So now, because if you keep eating this, it's breakfast, lunch, dinner, you know, every time we are hurting our bodies with every meal. When we stop doing that, then the body gets the chance to start healing. And then the body can really do a really good job, and very quickly. And they start cleaning out these plaques. I think when there are really old calcifications, that might be really hard to clean them out, but they won't hurt you. They will stay there. That's not a problem. But the plaques, as long as they are not really calcified, the body will break that down. So our immune system and everything that's in our body to heal ourselves, cells in our body, the white blood cells, for instance, they will clean out these arteries. And and they start doing that, and that might take a while before you get to that the plaque is nearly gone. But people will feel improvement. For instance, chest pain already very quickly in a few days or maybe a week time, they already can feel improvement. And that is maybe not firstly the plaque that becomes already smaller at that instance, but the blood vessels, they become more elastic again, they relax better, the blood becomes thinner because of what we eat, healthy food, and that's why you already see very quickly effects.
I think that what's happening is that animal products, eating them increases your inflammation. And when you stop, it just goes back to normal. Okay, so, I really would love someone to prove me wrong. Yeah, it's interesting. We do call it an anti-inflammatory diet, but when you think about it, it's probably not what's happening. You're probably eating poison, and then the poison stops, and then, so.